A study published in JAMA Internal Medicine tracked over 3,400 adults for nearly 8 years. The people taking strong anticholinergic medications, common drugs for allergies, sleep, and bladder control, had a 54% higher risk of developing dementia than those who didn't. Not one drug, a category. And most of these medications are sitting in your bathroom cabinet right now, recommended by doctors who never connected the dots. Hello, Health Campions. I'm Dr. Elias Hartman. In the next 6 minutes, I'm going to show you exactly which medication categories carry the highest risk, why your brain becomes more vulnerable to them after 60, and the one surprising finding, that the risk isn't about a single pill, it's about how many you stack together. Before we go further, drop a comment right now with just your age. I want to see who's watching, because how your body handles these medications is very different at 62 versus 72 versus 82. And if you've ever felt mentally foggy after starting a new prescription, add that word to your comment. First, let's talk about the anticholinergic burden. That's the medical term for how much your medications block a chemical called acetylcholine, your brain's messenger for memory and focus. Think of acetylcholine like the postal service delivering messages between brain cells. Block enough mail carriers, and messages simply stop arriving. After 60, your brain produces less acetylcholine to begin with. Some research puts the drop at nearly 30%, so there's far less room for interference. Next, let's talk about what's happening with your blood-brain barrier. That's the protective filter that decides what reaches your brain tissue and what doesn't. Picture it like window screens on an old house. Over decades, the mesh gets looser. By your 70s, that barrier lets more medication through than it did at 40, even at the exact same dose. There's also a second factor that most people, and honestly many doctors, don't realize: polypharmacy, meaning multiple medications interacting at once. One antihistamine alone might barely register. Combine it with a sleep aid and a bladder medication, and the anticholinergic effects don't just add up, they compound. Adults over 65 fill an average of 4 to 5 prescriptions simultaneously. That's not a coincidence in these findings. That's the mechanism. Part 5. Patient scenario. Let me tell you exactly what happens to a 71-year-old woman who comes to see her primary care doctor complaining of poor sleep. She's given a common over-the-counter sleep aid. 6 months later, she returns describing brain fog and mild memory lapses. Her doctor orders standard blood work, everything comes back normal, so the fog gets chalked up to getting older. Nobody reviews her full medication list against her allergy pills or her bladder medication. This scenario plays out thousands of times a week across the country, and it is preventable if we understand today's core insight. Now, here's the part that's going to sound counterintuitive, and I need you to stay with me because this is where everything changes. For decades, we've been told that occasional memory fog after 60 is simply normal aging. But research from the University of Washington tracking those same patients over time tells us something different. Much of that fog reversed, at least partially, when high-risk medications were reduced or switched under medical supervision. Most doctors haven't seen this research. Most patients haven't heard it. That gap between what science shows and what's actually happening in exam rooms, that gap is costing real people real quality of life. Now, I want to be completely transparent with you. This isn't about stopping your medications. Please don't do that on your own. Some of these medications are essential, and stopping them abruptly can be dangerous. This also won't reverse every case of memory decline. Genetics and other health conditions play a role too. But here's what the evidence does show. A simple medication review can identify avoidable risk. Tonight, do this. First, write down every medication and supplement you take, prescription and over-the-counter, because most people underestimate this by 2 or 3 items. Second, circle anything for allergies, sleep, or bladder control. These carry the highest anticholinergic scores. Third, bring that list to your pharmacist this week and ask specifically, what's my total anticholinergic burden? That single question asked by name gets a very different answer than, are my meds okay? You now know something that most people, including many healthcare providers, don't fully understand. Anticholinergic medications compound when stacked together. Your brain's filtering and messaging systems become more vulnerable after 60, and a simple pharmacist review, not fear, is the actionable next step. Most importantly, you now have the knowledge to ask the right question instead of accepting fog as inevitable. Your body is not working against you, it is trying to protect you. Once you understand that, everything changes, because now you're not fighting your body, you're finally working with it. If this information helped you, please share it with someone you love who is over 60, and subscribe to this channel, because my mission is bringing you research-based senior health information that is practical, honest, and potentially life-changing. I'll see you in the next one.